Hello, I'm Tu Kim Lam. Welcome to the Medical News. On this edition of the Medical News, we will talk about flu and the newest information about flu vaccination for this year. Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia, he will share with us this information. Please join me to welcome Dr. Tran to the Medical News.
So welcome to our show, Sin, again, and hello, Mrs. Lam.
Hello, Dr. Tran. This is the flu season, and a lot of places we go, we will usually see the sign remind us to take the flu shot. Before we go into the detail of the flu shot and the newest information for this year, would you explain to our audience what flu really is and what caused the flu?
Basically, I believe that most of the people in the audience already knows about the flu because we hear a lot about the flu vaccine before the winter, and mostly the doctors advise the patient to get the flu vaccine. But I think it's just a good time to discuss about the flu, what causing the flu. And I think it's very important because the flu has a lot of impact on our lives because it causes a lot of complications for the patient. And in the past, really causing a lot of mortalities for humankind back in 1918. So I think it's just, we want to talk about that today. The flu basically is the name is come from the name of the virus called influenza virus. So we cut it short, we call it flu, but it's flu really causing by the virus, but the name is influenza virus.
Dr. Tran, so how many types of virus of the flu?
I think we have only 3 different types of the influenza virus. The name is the influenza virus A. It's very common, it's very dangerous and very contagious because it can cause flu and infections on animals, birds, including human beings. And in the past, the influenza A is causing the pandemic. Pandemic means all over the world, the global infections causing what? Because of the one virus. Now, epidemic is only a small area, one local, regional area that affecting by the virus. So right now, really what we know is the virus can cause pandemic. This means all over the world can get infection from this virus. The second virus called influenza B, really less virulent than the first one and causing infection only for humans. The third one called influenza C, it causing human infections and also for pigs and dog and all another castles. I think it's just related to the swine flu that we're talking about.
Let's help our audience to understand the severity of the flu, also how important for us to be aware of flu pandemic in the world.
Well, basically, it is very important. I think it's just mostly important for the scientists and most of the physicians. They need to be aware of the histories of the flu because back in 1918, when the flu first appeared in the United States in Kansas, nobody knows exactly what causing all the mortalities in Kansas City and surrounding area. And then suddenly the infections moved to Boston, Massachusetts. And you can see on the screen different pictures of different locations in the United States. And later on in Washington, we also are affected by the flu virus and affecting a lot of people in Washington, D.C. Then the virus moved to Europe and affecting French and England and also Spain. Now, what happened in Spain because it's causing a lot of sickness for people over there, and then because the king of Spain at that time got very sick, therefore they just want to put the name of Spanish flu, because it's the first time in history of Spain they got so sick and so many people died from the virus. And in total around the world at that point in time, the number of deaths is about 20 million. In 25 weeks. What means we compare the death from the AIDS virus in 25 years, they killed about 25 million people in the world from the HIV. But compared with this virus, in only 25 weeks, they kill 25 million of people. How important we have to deal with the virus, because from that point in time, a lot of studies, a lot of money put on to study just the virus that's causing the pandemic. Now, later on, about 50 years after, I think we have another pandemic from China. Basically, they believe the virus come from China and then spread into the Singapore and back to Hong Kong and causing about, I think at that point in time, just about 1.25 million of people die from the second pandemic from the virus. And if you're able to remember the Hong Kong flu around 1968, when they call avian flu, because it comes from the duck and people in Hong Kong, they have to kill a lot of animals to prevent the avian flu to spread to other countries. In Vietnam, we also have a lot of people die from the avian flu, and most of the airport, most of the country, they have to block people immigrate or flying and traveling to other country in order to stop the spreading of the virus at that point in time in 1968. And most recently, if you remember, we had swine flu, another pandemic also, but this time we got the blessing because we already know the virus, we know how to stop them, we have to block people, do not allow them to travel to other countries, because when they travel, they carry the virus with them, and they kill all the animals, including pigs, in the farms. And so at least finally, we were able to stop the swine flu in 2009, and only about 18,000 people died from the swine flu. This is most recently now. So therefore, we look at the history, and we learn and we try to cope with the future. That's why we really carefully study on the virus. We know exactly where it's changing, where it comes from, and how to predict and to give the vaccine in order to prevent the disaster that may come in the future.
Dr. Tran, can you tell us how the virus spread?
Every time we sneeze and every time we cough, usually the sick person can spread into the air about 40,000 droplets. Droplets means the very tiny little fluid containing the viruses inside. Now, when people close to the people who are really sick and they're coughing, they can inhale the virus in their lung and their nose, and they will be sick in about 2 or 3 days. Now, if they're not around to the sick people, but the sick people continue to cough and sneeze in the room without covering their mouth, they can spread the virus to anywhere in the wall, and the door, and the table, and anywhere in the restroom. So anybody walk into that room, touch these table and everything with the virus, they're still able to get sick. So therefore, that's why it's a lot of advice. You have to wash your hand all the time. You have to clean up the table, to clean up anywhere that have the sick people around. So I think it's how the virus is spreading, either to the air or by contact, and from one person to another person by contact closely with the sick people.
Based in the history that you shared with us earlier, the flu is very dangerous. Can you tell us how dangerous is the flu?
If you look back, the pandemic is causing a lot of people, but now with technology, we know how to prevent them, so therefore the mortality should go low, but still have the risk of having severe complication from sinus infection, from pneumonia, and if the virus go beyond the lungs, it can cause meningitis, meaning infection in the meninges, and sometimes causing infection in the brain and anywhere else as well. Now, the virus becomes so important and may cause mortality for people like the children, the pregnant women, and also people with underlying medical problems like heart disease, cancers, diabetes, or they under the treatment with the immunosuppressive agent. Right now, there are people using a lot of medicine to treat the rheumatoid arthritis and chronic joint disease with the new medication called immunosuppressive, because they want to suppress the defense system of the body in order to relieve the pain on the people. But when they do that and they suppress the defense system, the people with this disease under treatment will get more problem because when they expose the virus attack them easily because they don't have much defense. The same thing with people with HIV, people with AIDS, they don't have defense system to fight back against infection. Therefore, these people need to be vaccinated to prevent the complication.
Dr. Tran, how can a patient recognize that he have a flu or does he have a common cold?
I think it's very common questions to anybody, especially the physician. They have to answer that question all the time. Usually we base on certain symptoms that we call cold, like headache, runny nose, sore throat, body ache, and feel tired. These are the symptoms of what we call cold symptom or common cold. But remember, common cold could be triggered by cold weather, exposed to the cold for a long time, or causing by the virus as well. But it's not severe, not strong like the flu virus. We call it rhinovirus. Rhinos mean attack to the nose first. Therefore, people have runny nose and headache. But remember, these symptoms compared with the flu vaccine completely different because the flu vaccine causing severe reaction, causing high fever, causing severe headache, and causing the symptom very important to remember, so tired. People have body ache all over the body and so feel tired. They couldn't really work. They could not really function. They just want to lay in bed. So this is the difference. Now, another issue we have to differentiate between the people with the seasonal allergy. Because people also have sneezing, they feel sick, they don't feel well, but they don't have headache, they don't have fever, and usually the allergy happen in seasonal, usually like springtime or fall or summer. So a little bit different. So remember, the flu symptom always very severe. So this is the difference from the other common cold that we also mentioned about. I got cold, I got some sick because from the cold, thing like that. But for the flu infection, completely different.
Dr. Tran, you mentioned earlier there are several different flu viruses. What kind of diagnosis that you make to know which virus this patient has so you can provide proper care for this patient?
Most the physicians or the healthcare professional can make the diagnosis correctly based on the symptoms, on the seasonal of the infections, and also to how many members in the family have been get sick. So based on these symptoms, most the physician can make the right diagnosis from the beginning. But in difficult cases, for instance, for the children, for people who have been sick for a long time, or people who will be in the hospital, they have to make the correct diagnosis by using testing. Now, in the old days, always we use culture. We got some mucus in the nose and the mouth, and usually put into the cultures media and wait until about 2 or 10 days until the virus grow, and we identify exactly what kind of virus causing the disease. Now, because it takes so long, so right now they try to get a little bit shorter. We have different kind of rabbit culture tests. Usually it cuts short about 2 or 3 days to get the result. Now, if you got the blood test, you can do it, but it takes about 2 or 3 hours to get the result. Now, finally, recently, we have the special test called rabbit influenza test. They give the result in 30 minutes because we don't have much time. And people need to know exactly what, especially in difficult cases, then the physician has to rely on the test. Otherwise, most of the time, they make the correct diagnosis.
Dr. Tran, can you share with us what kind of treatment that are available nowadays for flu?
The good thing is about right now we have the medicine to treat the flu infections. Remember, most of the medication over the counter with the name like Advil flu, Tran flu, really just provide some kind of relief for congestions and to relieve the fever or relieve the body ache, but really they don't have the antiviral part of the medication. Right now we have the medication approved by FDA. The first one, Tamiflu. The second one, Relenza. Tamiflu had to take orally. The other one had to take to inhale into the lung. Now, these are the specific medication they call antiviral because they have the capacity to kill the virus if the patient gets infection from the virus. Therefore, these medications will provide relief and maybe help the patient recover faster and able to use into any age really for the treatment of the viral infection.
Dr. Tran, would you please talk about the effectiveness, the benefits of the medication as well as the side effect of the medication.
The requirement of the treatment is you have to treat the patient early in about 48 hours. I mean 2 days after they get the infections. The medication will help to relieve the symptoms, including fatigue and body ache, because stop the replication or the growing of the virus in the body, and also help to recover quicker if we don't have any treatment. The group of people need to be treated, really the children, because their defense system is very weak, and also the elderly people over 65 years old. They have different medical problems like underlying heart problem, diabetes, including cancers, and other different kind of treatments. Therefore, these group of people need to be treated as soon as possible to prevent from any severe complication that may lead into the mortality of these group of people.
Dr. Tran, some patients tend to believe that once they got the flu shot, they're going to get the flu. Number one, is that true? Number two, can you share some of the side effects after you receive a flu shot? And how long does the flu shot last?
There's a question is most people complain about when they're afraid of the vaccine. They always say that when they get the vaccine, they got the flu. But the answer is no, this is not correct, because most of the vaccine made by the kill virus, we call this inactivate virus, means the dead viruses to make the vaccine. So therefore, when we give the vaccine to people, the dead virus cannot cause the flu infections. But people may react to the vaccine because they react to the chemicals, the substance we use to make the vaccine. So people may have some body ache, a little bit like flu-like symptom, or they may have pain at the site of the injections, especially when we try to use the nasal spray, the new one. And usually for the nasal spray vaccine, we use the vaccine already still alive, but it really reduces the toxicity of the viruses. So we call live attenuated viruses to make the vaccine to spray for people who are really afraid of needles. For the children, they cannot get the vaccine to the injections. And for people who really have allergy with the eggs and are afraid of having a reaction from the vaccine, because most of the vaccine nowadays make from eggs. Therefore, people with allergy with egg, they try to avoid these things. But this is the story why we have to consider different case scenario.
So Dr. Tran, so how many types of flu shot do you have?
Right now, really, in summary, I think it's just 2 kinds of vaccine. The vaccine have to give injectables to the skin. The second one is nasal mix. They just have to spray into the nose. And most of the vaccine right now come with the form of produced by eggs. So right now, with the new technology, they can make the vaccine to the cell culture instead of using the eggs like nowadays, because sometimes it takes a lot of eggs to produce enough vaccine. So right now they move to the tissue cell culture, either to produce quicker and faster the vaccine to deal with the pandemic or anything that may happen in the world. They have to prepare to do it instead of using the eggs. That's the experience most of the scientists learn from to dealing with pandemic in the past. Right now we have the vaccine with double doses in order to use for the elderly people over 65 years old, because they need better protection. They need a little stronger protection in order to help them to recover quicker when they got sick from the flu viruses.
When will be the best time to receive the flu shot, and who should get the flu shot? Besides the family doctor office, where can they go to get the flu shot, and does the insurance cover for the cost?
The best time to get vaccinated is around October, because the big season started around winter time, about December, and the peak of the virus infection is around January and lasts until May of the next year. So I think to prepare for that, the best time is about October, because most of the vaccine will be released a little bit sooner than that, and most of the offices, they have the vaccine available to give it to their customer or patients. And now the other question is how they can get the vaccines. Right now, the CDC really wish that everybody needs a vaccine. And which group do they target the most? Right now, the children, the pregnant women, and the sick people over 65 years old. For the strong people, the middle-aged and working, they can benefit from vaccine because they don't know when they got infected from other coworker or anybody work around them. So I think it's better to prevent them. So right now, the CDC advised to give vaccine to everybody before the flu season comes.
Well, besides their family doctor office, where can they go to get the flu shot?
They can go to the pharmacies, they can go to any clinics. It's very popular right now, it's very cheap. I don't think it's any problem if the insurance won't pay for it. The government will pay for it, or sometimes you just pay for a little money to get a vaccine. Is very beneficial for them. They can prevent the disaster. It may happen because nobody can predict what really happened in the future when a virus changing the pattern and causing another pandemic like we see in the past, in the Hong Kong flu and Mexico flu, things like that. So I think it's better to get the vaccine.
Dr. Tran, let's share what news for this vaccine this year and also what are the new research related to the flu shot.
The thing is very news. Recently, it's in October 15, the FDA decided to release the different kind of vaccine a little bit stronger. In the past, we used 3 different antigens of the virus called trivalent, but right now we use quadvalent. That's mean the quadruple the numbers of the antigen in the vaccine. So the vaccine will cover more different strain of viruses, whether they're changing the pattern or not. But hopefully the new vaccine will deal with more effectively with different kind of strain in the virus in the near future, especially in winter time. So therefore, right now they combine the old vaccine, the trivalent, with the 2 new vaccines. They call influenza from Australia, Victoria virus strain, and to put into the vaccine. Another one is from Japan. So right now we have 4 different antigens of different viruses from around the globe. So everywhere we can deal with that. The other one is very important is recently Dr. Udell from Toronto, Women's Hospital in Toronto, Canada. He did studies over 6,725 people in 5 clinical trials. And he found that the people really have underlying cardiac disease, means they have heart problem, they have bypass surgery, and they've been sick from long-term heart trouble. When they got the vaccine compared with the group of people who doesn't have the vaccine, they can see the numbers mortality in the people who they have vaccine is much better. Less people die in the group of have vaccine than people doesn't have the vaccine. So he come up with conclusion that really the flu vaccine, besides to prevent the virus, prevent the infection, but also reduce the mortality on people with underlying cardiovascular diseases. Now that studies basically is very good news for people, but need to be rechecked by different kind of studies or another further well-controlled study to confirm the findings of Dr. Udell.
Dr. Tran, before we go, would you give you have the last word of advice to our audience about the flu season this year?
What we're talking about means we try to understand more the virus, how they spread around. So therefore, the first thing first, you have when you think you got flu, you cover your mouth and cover and tell your family, friend, coworker, when you cough, better to cover your mouth because you don't know whether they carry virus or not. And now if you're thinking, you suspect somebody have the virus, advise them to stay home, don't go to work. If they go to work, they have to see the doctors to make sure that everything okay. Now, you know that the virus go through the air and contact to the table, to the wall, to the toilet room, to the door, everything. So you have to clean up these if you suspect somebody's sick in there. And you have to wash your hand very often during the flu season because it's the only way to prevent some way, somehow. If you're able to touch something that you have to carry the virus. Thirdly, you have to get the vaccine. That's the simplest way, the cheapest way to prevent any disaster. It's just a little money, you can prevent a lot of things. And lastly, if you got sick, you feel like you got the flu infections, better to get treatment right away in 48 hours. This may save a lot of things for you, and especially the complication from the viral infections.
So one more time, who should get the flu shot?
Anybody over 6 months old and up to the elderly people, everybody can get the vaccine.
Thank you, Dr. Tran. That is all the time we have for Medical News Show today.
Thank you for watching our show today. I think remember is medical's knowledge is always progress and advance in the future. So what we provide for you today maybe is maybe changing in the future when the new studies and new discoveries regarding the virus here. So remember that. But I think it's hopefully you able to get something from the presentation today when we sharing the knowledge about virus and in order to help us to get the vaccine and prevent the disaster in the future.
Thank you, Dr. Tran. Thank you for joining us.
Thank you for again.
That was Dr. Sang Tran, who just shared with us the information on the flu and the update news about the vaccination for this year. We hope the information provided by Dr. Sang Tran has shed more light on the flu disease, and we hope that you can prevent and take care of yourself and your loved one better. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News.